when somebody has COVID-19, they will shed the genetic material of the virus in their sewage. And we sample that over a 24-hour period from the wastewater treatment plants. We also look at a few neighborhoods around town on a targeted basis. And from that, we're able to look at trends of COVID-19 in that part of town on a population basis. And so since we've been doing this, as we've gone through different variants, we've seen the rise and the fall.
What we have seen recently with the emergence of the Omicron variant corresponds very well to what Dr. Dart was talking about with the highest cases that have ever been reported. Similarly, in wastewater, we have seen some of the highest concentrations that we have ever reported throughout the year and a half that we've been monitoring wastewater. And we have, for the past couple of weeks now, been at a very high plateau. And I'm also slightly optimistic to report that we are seeing signs of what appear to be a decrease in concentration. So this obviously is not reflecting any trends in human testing, as we might remember. So this is actually reflecting real community transmission levels. So from our point of view, there is good indication that the community transmissions levels might be at decreasing now.
And I would add to that that our concentrations in general will precede count numbers on cases by 7 to 10 days. So when we're seeing a peak in our concentrations, the peak in the cases will be 7 to 10 days later in Tulsa, in the Tulsa area. I will add that the wastewater monitoring is more than just COVID-19. We're also looking at a variety of other pathogens that are useful for the health department to look at things like norovirus, influenza A and B, Campylobacter, which is a stomach bug, some of those types of things. So I believe that both sides see the utility, and hopefully we'll find ways to continue this beyond May as well.